still have one of the flags in the shop. Where would you put it? And move those in. I think moving those in makes it. Yeah, but is it not? Can you not accomplish when you start on the flags and not move something else in the pull it off the shot? Spread them out. Exactly. Spread these three to the water and these three to the water. Oh, yeah. A little more than like right behind the chair.
Great. Greg, you're impossible. Leave it to the experts.
Hey, yes. first, let me say how pleased I am to be back in Puerto Rico for this important event. I apologize for running late. The airplane that was supposed to take me down broke down, so we had to wait, but I'm thrilled that it has worked out for me to be here with all of you, and I'm looking forward to hearing from all of the panelists. I have had a great opportunity in the past to work with a number of you. Also, as a senator of New York, I felt strongly that I was representing Puerto Rico as well as the state of New York. And I'm here today because I'm running for the President of the United States and of Puerto Rico. I believe that our President should give just as much attention to Puerto Rico and the American citizens who live here as to people anywhere in our country. And one of the challenges we face, which we will discuss today, is the unfortunate legacy of inconsistent, incoherent, and inequitable treatment for health care here in Puerto Rico. And so I want to hear from the experts around this table. I do like to listen and to learn more about the challenges that Puerto Rico is facing, so that then I can offer some more well thought out responses, because the people who are on the front lines, like those before you, have much to teach me, as well as the rest of us. So with that, I would like to turn it over to the panel and thank everyone associated with this superb institution. The gratitude that I feel for the work you do every day. I was learning a little bit more about it even as I was meeting with some of the officials here, and it's very encouraging to see this institution providing life-saving work for people of Puerto Rico and indeed across the Caribbean. And I applaud the administrators and the physicians and the nurses and everyone associated with the cardiovascular expertise that you provide. I want to now turn it over to our panelists and ask them, please, you probably know some or all of them, but each one will introduce himself or herself and then make their presentation. So with that, let me ask all of you to begin.
Good afternoon, Mr. Hillary Clinton. My name is Ana Rios, MD and Secretary of the Department of Health of the Commonwealth of Puerto Rico. My pleasure to be here. I made a presentation about the problem of Puerto Rico. Puerto Rico is facing many challenges with the Medicaid and Medicare funding due to a reduction of 11% in Medicare reimbursement for the year of 2016 and Medicaid fiscal cliff, which will occur approximately in 2018. Once AARP funding for Puerto Rico Medicaid ceases with no additional funds provided by the Congress. In the Medicaid issues, we have that Puerto Rico has 1.6 million beneficiaries of Medicaid. 45% of the Puerto Rico population. 1.4 million are federal eligible and 200,000 state eligible. We are a number 14 in the states, in the US. We currently spend $2.7 billion in the PSG or government health plan, an average of 165 PMPM. Federal government contributes with 55% 1.4 billion due to ACA funds. And the government contributes with 45%, $1.2 billion. We are the number 36 in the USA in expenditure in healthcare. In 2018, the federal government contribution to Puerto Rico Medicaid will decrease by $800 million, from 1.2 billion to $400 million, from 55% of the total amount to a mere 20%. Because of the Medicaid cap, American citizens that live in the Commonwealth are treated differently than the mainline counterparts. We are asked or requesting that the Congress act to eliminate the cap for Puerto Rico Medicaid funding and provide the parity to the Commonwealth using the same FMAP, the formula, as other states. In the Medicare case, Puerto Rico citizens pay the same taxes as U.S. counterpart for Medicare. There is no difference. Puerto Rico has the highest national enrollment in Medicare Advantage, over 70% of the total Medicare population. MA has a high penetration in the Puerto Rico when compared to USA. We have 500,000 enrollees in Medicare Advantage. Medicare Advantage is preferred over traditional Medicare due to the benefit and copayment coinsurance available to the beneficiaries. Our people can stretch the dollar, can use adequately the dollar. CMS enacted an unfair rate reduction of 11% for MA in Puerto Rico for 2016 compared to a 3% of reduction on average in the U.S. mainland. Puerto Rico does not have a low income subsidy that the state has, which places significant burden on our beneficiaries' ability to pay for MA. CMS data analysis that led to rate cut decision was based on incomplete data, which led to a misinformed decision. So we are asking or requesting that CMS should freeze a rate cut decision until proper analysis with complete data is performed. MA has been very successful in Puerto Rico. It should be protected because of the way it benefits to our senior citizens.
Thank you very much, Dr. Ruiz. Thank you.
Good afternoon. Good afternoon, Ms. Clinton. My name is Orlando Gonzalez. My name is Orlando Gonzalez. I'm the president of MMN Healthcare. We're the largest Medicare Advantage insurance company in Puerto Rico, the first also Medicare Advantage company. And we have to deal day by day with the beneficiaries of Medicare on the island. I think you probably know Puerto Rico enough to know that Puerto Rico has many issues that divide us. But in this topic, when it comes to healthcare, regardless of the sector, you got the hospital here, you have the nursing, the pharmacies, you have the physicians. Everybody's united because we're talking about the healthcare of the people of Puerto Rico, particularly the people that need the most. More than 60% of the population in Puerto Rico depend on Medicare and Medicaid to get access to the healthcare services. And as you heard from Dr. Rios, those funds are right now in jeopardy for different cuts that comes because of the ACA implementation and also because of the expiration of the Medicaid funds. So it is imperative that action be taken in Congress and also by the CMS administration to deal with this situation, because we're talking about the people that need the most on the island. I'm pretty sure you will agree that it is very unfair that a senior citizen, just because lived in Puerto Rico, being a U.S. citizens, will be getting much less funds for their access to care. As the secretary said, for 2011, Puerto Rico is facing an 11% reduction in the funding, when in the States it's an average of a 3% increase. That's a 14% difference that it makes really no sense. So, particularly on Medicare, because the Puerto Rico citizens pays Medicare in the same percentage as any other citizen in the United States. So we urge really the administration, and we're very hopeful that when you become the president, you're gonna take care of these issues.
Thank you, Mr. Yes.
Madam Secretary, thank you for coming. I think that you know pretty much most of the problems we have in Puerto Rico and some of the issues we have. Myself, as president of the Puerto Rico Hospital Union, has been many times going to Washington to explain what the situations are in Puerto Rico. Puerto Rico has a great healthcare system. Puerto Rico has done very well in taking care of our patients with half of the money that anybody in New York or anybody in California or anybody anywhere else would do it. And we're very proud of that heritage. We're very proud of the 70 hospitals we have. We're very proud of our doctors. But it's coming to a point where sort of a perfect storm, the concept of the perfect storm, is getting very close to us, where the necessities of delivery of care and the monies available are not going to equate. They're not going to be the same, because Puerto Rico hospitals, for example, are reimbursed basically around 52% of what the same hospital would be reimbursed in the US. And that puts a strain on where our patients are really going to get their services at one point or another. We have had a lot of things we have done in Puerto Rico to work with that, but it's getting to a point where if we are not helped by going to an equal situation as to the hospitals in the States, or to the doctors, or to whatever other kinds of service there are, I think that our patients are going to suffer, and they're going to suffer greatly, because even if we want to do the best, ain't going to be available. You know? So I think that we have worked it out, and we have gone. I think that there are issues that are administratively, and I think that CMS and the White House should take care of them real fast. I think that there are issues that are legislatively. I think that, for example, getting the hospitals to pay 100% is something that we probably could do if there is a will.
Explain that to me, please.
Well, the Puerto Rico hospitals right now are paid on a 75 percentile of what the hospitals in the States are paying. And this has to be brought up to 100% through legislative action of Congress. Congress has gone through the years from 25%, we were reimbursed before 25%, then we were reimbursed 50%, then in 2001 or 2002 we started being reimbursed 75%. But we're still missing a 25%, which the Congress could do right away. That doesn't take, it's an issue that between September and November of this year, if there is a will, we could do it. Then the issues of the things that need to be worked in the formula for hospitals that affect MAs, that affect other services, that needs to be worked out, because the formula that you have is a long formula. You take one and you multiply it by 2 and you divide it by 1 and you keep on going on and on. But for example, there are issues there that where we're zero. Let's say that disproportionate share, the hospitals that provide services to Medicaid patients, that formula requires a number, and then it is multiplied by the SSI. Puerto Rico has 0 SSI, so that number goes out the
So you get no dish payments.
Well, we get dish payments, but they're totally different from the dish payments that we get in the States, because when you multiply that dish factor by the SSI, it's not there. The other issue that we have that could be work administrative, and that's our feeling, is, for example, the wage index. Puerto Rico, for example, has paid the professional in healthcare around $37,000, and in the States they get paid 78. That difference makes the wage index, our wage index, when it's factoring every year, very low. There is no way we can upgrade our salaries, but then the non-labor factor, because of the formula the way it is working, the non-labor factor of that, which we have proved that the cost of doing business in Puerto Rico is the same as in the States or higher, does not go up. So that brings the formula down again. We feel that we need at least a one-time fix on the wage index, administratively, one way or the other. So that basic formula can go up, and then from there we can build our own wage index system. So those are some of the basic factors. We have described that maybe in Spanish, but we can do it in English. Through this, so I'll leave you with our magazine, which tells you, and it's both the same.
I can read
as-
crisis.
Crisis. So thank you very much.
Thank you very much. Before I
Yeah.
turn to our next speaker, Dr. Ramos, do you know what the reimbursement levels are and what the comparison is with other places, like say the Virgin Islands?
The Virgin Islands have a higher reimbursement, much higher than Puerto Rico, and that's a little bit of a mystery sometimes, and we know. Ron DeLugo was representative of the Virgin Islands for about 28 years, so he got great seniority in Congress, and he was able to do many things that we haven't been able to do. So they're getting rates, either New York rates or they're getting Florida rates.
They're getting New York or what?
New Jersey.
New Jersey.
The Medicare to the town in New Jersey has the same gypsy for Virgin Islands. Not any study.
It was an exception. They made an
Exception.
exception and basically put it apart with New Jersey, so that basically the reimbursement is much higher. That it should be. Actually, it's about almost 40% higher than the basic fee-for-service rate on the island.
And one issue when you look at some of the territories and things is that Puerto Rico is 90% of all of the territories,
Right, Right.
population-wise.
right. Thank you very much.
Dr. Victor Ramos, President of the College of Physicians and St. John's Association of Puerto Rico. First of all, Madam Secretary, the legislature has created guilds or associations for each of many health-related professions in Puerto Rico. We have the nurse, and I represent the 10,000 physicians in Puerto Rico. Having said, there are a few basic facts that illustrate part of the brain drain triggered by inequality in federal healthcare funding. We lost over 3,000 physicians in 10 years, 12% of all the physicians. Last year we lost 361, 3.5%, and this year probably for be 500 or more due to Medicare Advantage insurance canceled the contract with 700 doctors recently. The severe brain drain creates very dangerous shortage. We have only 2 pediatric cardiothoracic surgeons, one half 90 years old. 5 geneticists, 2 bariatric surgeons, 4 burn surgeons in Puerto Rico. What has to be done? The gypsy formula must be correct to reflect true costs in Puerto Rico. The current formula places Puerto Rico at the cheapest jurisdiction to practice medicine under U.S. flags, despite higher rents, electricity rates that are 2.5 to 3 more than in the nationwide. The Puerto Rico Statistics Institute made a study financed by our organization that proves that the current formula grossly underestimates true costs. You need to focus also on the fiscal cliff now. The new president will encounter a fiscal cliff in healthcare funding in Puerto Rico, in which ACA funding will drop to 0 sometime in late 2017 or early 2018 because Puerto Rico government has burned through block grant faster than estimated. This year should be urging OMB and the White House to start addressing the issue in 2006-2007 budget proposal. Your transition team must address the issue during the transition to assure the 207-18 budget prepared by existing administration fully address this issue. You can help defend physician right to work in Puerto Rico. You must demand as a precondition to supporting Medicare Advantage improvement that health insurance company resigns the cancellation of contracts to 700 MD recently left without work, which we forced to leave Puerto Rico if insurance are essentially allowed to determine who practice or doesn't Puerto Rico. This cut in physician contract not only ration the number of physicians but will create even longer periods for medical appointment for patients in Puerto Rico. Once again, thank you for focusing on the very effect on inequality in federal healthcare funding in Puerto Rico. We sure that when you're going to be president, you're going to address the healthcare issue, the territorial issue that have all the problems of the funding in Puerto Rico is part of the territorial issues, and you are going to be the president. Then end the problem with the healthcare issues and the territorial issues of Puerto Rico.
Thank you so much, Dr. Ramos.
Good afternoon. Welcome. This is Julio Ramos, representative the both College of Nursing, the practical nursing of the registered nursing. I have the 2 points. The first, maybe summary, the presentation for is the allocation of the necessary fund for Medicaid, Medicare, or general fund coverage. This will help in the retention for the medical staff and nursing. I have the one exodus for nurses and physicians. Well, the second point is the credentialing process for the nurse. We need
What
the
kind of process?
Credentialing.
Credentialing.
Yeah. Process need to the standardized to the mid-level for 15 state.
Well, I want to follow up with you and also with Dr. Ramos. On the credentialing, are you saying that there's a different credentialing process and you want the same credentialing process?
Well, no, is the difference for the nurse. So nurse maybe needed so the one state for Florida is the endorsement for license to nurse. The all state, the nursing needed they take the new exam for.
I see. So if they move to
Yeah.
Florida, they have to take another exam, even though they're already credentialed here. Okay.
Well, needed standardized.
Right, right. And Dr. Ramos, you said something which interested me. Is it your point that the main reason behind the exodus of doctors are the cancellation of the contracts?
No, we
Okay.
have a problem for many years. For this year, we probably have 500 physicians leaving, and more because recently the Medicare Advantage program canceled the contract for 700 physicians in Puerto Rico. Sometimes this cancellation means 80% of the patient of this doctor.
I see.
We have no choice than to leave the island.
Okay, okay. That's very
Thank you.
helpful. Thank you so much. Yes?
Welcome, Madam Secretary. It's a pleasure to have you here in Puerto Rico. This week I was in Washington, D.C. at the AARP meeting. I just came back today from D.C. also at noon. And Nancy Lamont, our Senior Vice President, she was saying that in 2031, 1 out of 4 Americans was going to be 60 plus. In Puerto Rico today, 1 of every 3 Puerto Ricans is 50 plus. We're aging so much faster than in any state in the U.S. Maybe even faster than Maine and Vermont, who are the ones that are the oldest. So we have a huge issue here with the aging of the population, and we need to really develop an integrated, easy access healthcare system to provide the well-being of the seniors here in Puerto Rico. I'm gonna read a couple of things that I have here for you. It is a well-known and it's very hard to find congressional solutions to Puerto Rico healthcare disparities due to the existing gridlock in Washington, D.C. This means that we need to start with some administrative actions HHS can take to ease the stress of the Puerto Rico healthcare system. In AARP, we have extreme concerns with the devolving healthcare landscape on the island and its implications on the well-being of Puerto Ricans, U.S. citizens in Puerto Rico. The nature of the challenges facing the federal programs in Puerto Rico will have an impact on the complete healthcare system, public and private. AARP is not only aware of the current state of the challenges we face, but is also engaged on how to solve these issues to respond specifically to the island's unique and emergent situation. As a result of the inaction to solve the federal program's challenges we face, a healthcare professionals migration, like Dr. Ramos said, and a reduction of network providers, that was mentioned before, will have a direct impact, and this is a extreme concern we have in the access of healthcare services in Puerto Rico and the quality of the healthcare services in Puerto Rico. In July, AARP sent a letter to Secretary Burwell with recommendations of administrative actions in the short term to ease the stress of the Puerto Rico healthcare system. And I have a copy for you here
Good.
of the letter we sent
Thank
to
you.
the Secretary of Health. In that letter, we talk about Medicare. We talk about the recalculation of the fee-for-service rates. We talk about the treatment of hospice cost, the hospital cost, like Jaime Pla talked earlier, and the Medicare fee-for-service. We also talked there about in the letter about a recommendation of how the Secretary of Health can say that Puerto Rico can have an emergency waiver under Section 1135 of the Social Security Act, that they can add some more funds on Medicare, Medicaid, and SHIP to have an authority to provide additional funds under these programs in case of certain emergencies. We recommend that they use that emergency waiver due to the economic situation of the island, the crisis, financial crisis we go here in Puerto Rico right now. In the search of long-term solutions to the island's health-related challenges, AARP will support the creation of an HHS work group to establish a coordinated and long-lasting mechanism that engage the representatives with ties and expertise on Puerto Rico unique challenges.
Now, to make sure I understand that, you want to have a special
A work group.
of people.
It's important that we create a work group that has people that understand and have ties with the healthcare system in Puerto Rico, so they have the insight of how to solve the issues.
Okay.
Okay. We have some concerns in AARP, and not just in Puerto Rico, it's nationwide. It's our concern that insurers' business decisions cause potential disruptions for their beneficiaries. One of those is allowing MA companies to alter their networks or PBMs during the calendar year after the subscribers have chosen the specific MA plan because it had their doctors or the medications. So within the enrollment process, I choose this company because it has my doctors and it has my medications. All of a sudden, it's January and February, then cancel those. And then the reason why I chose that specific MA.
Yeah, right. I've heard that before.
Okay, Medicare Part B, and that hasn't been mentioned at the table yet. Puerto Rico is the only U.S. jurisdiction where Part B is an opt-in and not an auto-enrollment. Therefore, many Puerto Ricans pay high penalty fees for late enrollment in Part B for the rest of their lives. If people cannot pay Part B, they should be able to make informed decisions on the consequences of opting out Medicare Part B. TRICARE, the veterans. Puerto Rican soldiers fight shoulder to shoulder to the rest of the soldiers from the States and deserve the same treatment under TRICARE right now. They only have access to TRICARE Standard, but not to TRICARE Prime. That will allow better health care for those who fought under the same flag.
They don't have access to TRICARE Prime?
No, they only have access to TRICARE Standard.
Really?
Mhm.
So that's a VA decision.
It is.
Okay.
So thank you so much for being here and listening to us. And I know that when you become president, you'll be very engaged with Puerto Rico, who supported you before, who support you now.
Please.
Hello, Elda Sierra, pharmacist, and I welcome you here to the island, Mrs. Clinton. Funny, always the pharmacist is the last one to see the patient. He is the one that gets all the screaming and all the yelling because the plan does not pay this or the hospital did this or whatever. But we know how to deal with that and calm the people down. It's very sad, and it's going to happen right now during this month, starting in this month, September, because of what was already mentioned of the low income subsidizing. Our patients here now in these last 3 months of the year will be getting into what we call, or what Medicare calls, the donut hole.
Mm-hmm.
And they won't have enough money to pay their deductibles right now. So I'm starting to see that already in our pharmacists. And we have here, gladly, we still have here in the island about 800 community pharmacies. The patients are going to start making decisions on, will I buy the medicine that I need to be better health, or am I going to take a decision on paying my rent, my food, my electricity, power, whatever? And sometimes it's kind of hard to hear them say, I cannot take my insulin because the deductible is too high for me. And it's kind of sad that after you've been able to have a patient adhering to their treatment for the last 6, 7, 8 months, and then all of a sudden they will start visiting the hospitals, the emergency room, because they have not taken their medicines adequately because of the loss of money. Contrary of what happens in the States, that once the patient enters the donut hole, there comes around another grant, and that helps the patient pay for the deductibles. That does not happen here in Puerto Rico until, again, in January, we start all over the story all over again. That, as I see it, will never help us in the pharmacy area see our patient achieve the famous 5 stars, which are being right now the way we are being evaluated on how we have help our patients get adherence to the treatment, because in all the year we've been helping them, and then on the last 3 months it's going to go downwards. Okay? And so I don't see that we will ever be able to comply with our 5 stars and help the doctors with their patients. So in 2008, President Barack Obama made a commitment to Puerto Rico, and he knew or expressed that Puerto Rico was excluded from the low-income Part D subsidy of the Medicare prescription drug program. Instead, Puerto Rico receives an additional block grant in Medicaid to serve the poorest Medicare enrollees, leaving tens of thousands of low-income seniors without any assistance. Obama promised that he would work to in-phase an extension of the low-income subsidy to enrollees on the island on the same basis as in the States. But this has not happened yet. So we are looking forward that our next president President, Mrs. Clinton, and first lady to be the President of the United States to help us. To help our seniors, because as Mr. Acaron said, next year probably a lot of the ones that are here will be entering that time of the life. And
Lovely, wonderful time.
that very,
Look, you're an example of that.
I like it.
and we will be needing that help also to pay our deductibles to achieve a very good health and be able to live for quite a few time to see our granddaughters and grandsons achieve their dreams also, and not to see our daughters and sons leaving the island and taking us with them, because there's going to come a time where they are leaving and then they would like to leave us here and leaving the island also.
Right.
I would like to add something to that. I was in Connecticut in the summer. I met with a couple of the state representatives in Connecticut, and we were talking about that, how the issues that we have here in Puerto Rico with Medicare will make people start migrating to the states, and how will impact their budgets in the states. So, and I already know some friends of mine who live in the state that they have been taking their parents with them because they have better services and more access to healthcare in the states than here.
Right.
And that's it's kind of sad. And I would like also to add to my comments that we will be having the problem also that the medicines here in Puerto Rico, the only way they come in is by air or by water. Right. There's no other way that we can receive medicines. So that makes medicine here in Puerto Rico costly. And in the States, probably the deductibles could be much more lower because the companies are over there and they can buy at lower prices. Here in the island, our prices are much, much higher. So when it comes to paying deductibles based on the cost of the medicine here in Puerto Rico, that's another problem for our seniors to meet the deductibles.
Right. This is very helpful. Any additional comments that anyone? Yes.
If you allow me, there is one additional item that is sort of adding salt to the injury. That it's it's called the hit, and it's really hitting Puerto Rico very hard. And this is a special tax that the IRS put to the health insurance business in the nation and in Puerto Rico. And basically, you have to pay a percentage of your gross premiums every year, and you pay that money to the IRS. Supposedly, that money is to fund the exchange program. The problem is that Puerto Rico don't have an exchange because by mandate, Puerto Rico was only allowed one of the three options, and Puerto Rico was basically given a block grant as the only option for Puerto Rico to implement an exchange. Nevertheless, you have to pay exactly the same percentage as in the state. That represents for Puerto Rico more than $150 million that Puerto Rico has to pay without getting any benefit back.
Do you want to talk about that?
I agree with him, and it's an issue that is very important to resolve because it's $150 million that could add
No, it's
to
basically
give
what is
a better
doing.
services in the island.
Yeah, and what it's doing is hurting the reserves
The
that the insurance companies need to have. You have the Commissioner of Insurance sitting there, and she can attest to what I'm saying. And it's really putting a lot of pressure on the industry because.
So I just want to be sure I understand. So we have the insurance commissioner here.
Right, yes.
And I'd be happy to have you add to that, but let me just understand. So the tax on insurance companies that was included in the Affordable Care Act,
Yes.
affects your companies even though you're not able to take advantage of the exchanges and the subsidies. Is
We
that
have
Exactly.
no mandate and no subsidies, and still we have to pay that approximately $150 million this year, and that's going to increase.
It's going up.
Okay, and our companies are hurting.
And
hurting
these are primarily, these are Puerto Rican companies plus Puerto Rican subsidiaries of national companies?
It's all the insurance companies that are doing business with all the different medical plans.
So if you do business in Puerto Rico, on your business in Puerto Rico, you have to pay the tax, even
Exactly.
though you can't offer the services through an exchange that
Yes,
are offered
Yes.
elsewhere.
Exactly.
That's
And that
really,
hurts both the
that is
companies.
adding insult to
Yes.
injury. I think that was a
And
fair,
that hurts both the local companies and the US companies that do business in Puerto
and that's $150 million.
This year.
This year,
That's
it's going up
to increase
because
next
the.
year.
And that comes from the companies themselves, or it comes from a
It comes
combination?
from the companies, and they can, you
They
know,
pass it on.
They can pass it on to the consumer, so really the ones that are ending up paying it
Uh-huh.
is the consumer.
No,
And
it's-
the piece of
it's
the
always
bill
about
of
us.
the government plan, the government has to
The
pay
government
for it.
plan.
So actually, the federal government is paying part of it too. So it makes no sense. And we have gone to Treasury, we have gone to the president, we have gone to every single place that we can think of to ask for relief on that, which we think could be an administrative relief very easily given. So.
Is that in this letter, or is that a different issue?
No, that's a
That's a different
I can
issue.
share with you
No, that's a
letters
different
that
issue.
I have sent to the secretary.
Yeah.
Good.
We have
Okay.
plenty of.
And I think that there was a conversation not too long ago with the IRS, and they refused
That's correct.
To make any exception.
to make any exception. And that was about 2 weeks ago. We're very,
Recent.
Well, that does add an additional challenge to the whole picture.
I don't know if that would go with no taxation without representation.
Well, you certainly could make the argument. Anyone else? Because that was a great last minute addition, because I did not know that.
Well, I have another one.
Oh, good, good. I came to listen.
I know. Well, when the incentives were given for the electronic health record, there was
The electronic-
the electronic health record. There was $19 billion done to the AARP program for incentives to the hospitals to develop the electronic health record, and the Puerto Rico hospitals were left out because of how the law was written. There was no intention, everybody tells us that there was no intention of leaving us out, but the definition that was used for the hospitals, which would be subsection D of the Social Security Act, only includes the hospitals in the 50 states and the District of Columbia.
Ah,
So when they defined that, because they wanted to define acute hospitals, and it was very easy to do that through that, and that means that the hospitals in Puerto Rico are developing electronic health records without any real incentive for doing that. So we are lagging behind. I think that this conversation goes to show you that we are heading to a situation which may not be the best one in the very short future, not in the long future. Maybe in 2000 we were talking about the long future, but now it's getting to a point where it's the short future.
right. It's right around the corner.
Right around the corner.
Yeah. Anything else? Well, this was incredibly useful. I have a lot of notes, some of which I already had in my briefing, but some of which I'm hearing for the first time. And I thank all of you for sharing your experience. And I agree with the last comment that this is all moving to a head. The timing on a lot of these changes and the impacts on Medicare and Medicaid and the Medicare Advantage and all of the whole suite of healthcare programs is certainly going to have a dire effect on the people of Puerto Rico, and it will further exacerbate the exodus of doctors and nurses and of families because obviously you have to be worried about what kind of health care you can get if people are moving to Florida, New Jersey, Connecticut, wherever they might be. And your point about how once you move to the States, you get the same benefits that anybody who's an American citizen gets.
Right. It is geographic discrimination because in America, they lose.
Well, it's just hard to justify how you can be an American citizen in Puerto Rico and be treated differently in so many ways from being an American citizen anywhere else. And it's really hard for me to accept that, as it must be for all of you, because especially when we think about the large numbers of Puerto Rican sons and daughters who have served in our military, who have fought in the wars of the United States, who have paid the ultimate price. And I remember very well back in 2008 going to a memorial and learning more about the great heroic service and duty that Puerto Rican young people have exhibited over the years. And so this contribution that you've made over so many decades is one that I think first and foremost demonstrates unequivocally the role that Puerto Rico has played in our national defense, in our culture, in our history, and so many of the other contributions. The challenges you're facing really, for me, illustrate this disparity. As I said earlier, I think no one who is fair-minded could listen to this and conclude anything other than the way Puerto Rico is being treated when it comes to health is inconsistent, it is incoherent, it is inequitable. And your examples just clearly drive that home. And it just shouldn't continue. And we must do more to deal with what is morally wrong and economically disastrous for the people of Puerto Rico. And as you rightly point out, it also will cost other states. This is a problem that can be solved by people literally voting with their feet. And that is not a fair burden to impose upon the people of Puerto Rico, American citizens, and particularly for older people. You know, for a son or a daughter to say, come move with me to Connecticut or to Florida, when somebody's lived here their entire lives, when their social network, when their entire sense of themselves is rooted here in Puerto Rico, is just wrong. As president, I will do everything I can to put Puerto Rico on a path toward equal treatment under clearly, I know about the unequal treatment under Medicare and Medicaid, but now I'm learning about the unequal treatment under the VA TRICARE program. So this is embedded in so many of the health programs that people deserve to be able to access because of their citizenship. And secondly, I think it is clear that you can't solve Puerto Rico's healthcare crisis without addressing the economic problems that you are confronting. And I know that there have been a lot of calls from people for greater austerity measures, but I do not believe you can fix your economy through austerity alone. And I have tried to follow some of the negotiations that have been going on. I know there was at least an apparent deal struck to restructure some of PREPA's debts. Now Congress needs to do its part, and that means it should give Puerto Rico the authority to let severely distressed government entities, including public corporations and municipalities, restructure their debts. There is no alternative because the debt is so large and it is impossible to restructure it without the kind of help you get in bankruptcy. And that should be something that we all work toward. I know political leaders across the spectrum agree to that here in Puerto Rico, but not a single Republican has stepped up in Washington to support the leaders of Puerto Rico. And they're not offering any alternatives either. And that is just unacceptable because this is a crisis. We've talked this afternoon about the healthcare crisis, but it goes hand in hand with the economic crisis. And you deserve better than that. I was talking to some of my friends. I remember coming here in 1998 after Hurricane George. I actually led a presidential delegation to get a better idea of the devastation. That led to a special task force that was put into place to make sure Puerto Rico got the help it needed to come back from that terrible hurricane. Well, I think we're in a similar situation now. It's not a hurricane, but it's a perfect storm, as one of you said. A perfect storm of economic and healthcare challenges, exacerbated by the fact that there are gross inequities in the way that Puerto Rican citizens, American citizens, are treated. So we need the same spirit of solidarity now. And this is one of those problems: solve it now here, or deal with it later somewhere else. And it just seems to me that it's a more humane, practical, smart alternative to deal with it here. Now, third, I would have to add that many of the challenges Puerto Rico faces, whether economic, healthcare, or anything else, tie back to the fundamental question about Puerto Rico's ultimate political status. And ever since you became a territory, leaders from all across the political spectrum have wanted a form of government that permits Puerto Rico's national laws to be democratically determined. This comes down to your basic rights, as many of you have heard me say already. Puerto Ricans have the right to form a government of your choice that is representative at all levels of government, just as you have a right to equality as American citizens. You have dealt with this issue multiple times, most recently in November 2012. Also, Congress has now passed a law that would resolve this issue through another plebiscite. The next step is for Puerto Rico's Elections Commission to submit options to the U.S. Department of Justice to ensure that whatever choice Puerto Rico makes will be respected. And I want to emphasize that because ultimately this has to be your choice. But I want to be sure that the United States government, in particular the Congress, is obligated to honor that choice. And for me, this is vital to Puerto Rico's future, but it's also vital to the future of the United States because it speaks to the kind of democracy we are. And we need to empower the people of Puerto Rico to make these decisions for yourselves. And we can't do that until we have a resolution, however you decide it, that will be respected and implemented by the Congress. So I think that it is a perfect storm right now. It is a challenge that is really taxing you on every level. And it is something that I want every American, wherever you live, to understand. There are still too many people living in the States who don't even know Puerto Ricans are citizens. That's right, right? In fact, somebody was telling me earlier that in some places now people are being asked for green cards who are from Puerto Rico. And when you say, wait a minute, I'm an American citizen, people, what do you mean? And so we have some education to do in order to lay the groundwork for whatever choice you make, it will be respected, but also to deal with some of these inequities, to make a very strong argument that we're talking about American citizens who deserve all the support that they can get anywhere else if they move to any other part of the country. So, now, I know that this is not easy. I know we've got work to do. But I do want to pledge my absolute commitment. It will be at the top of my priority. I think there's some things we have to do between now and January of 2017, when I will be inaugurated. We do have to intervene with the administration, continuing to do so with the Congress, but then we have to have a longer plan. And we need people here to agree on that plan. And one of you said you are unified when it comes to dealing with the healthcare crisis. Strength is in unity. When you can be divided, you can be conquered. And I'm not telling you anything because a lot of the people in this room are both experts and veterans of a lot of the challenges in getting Puerto Rico to be treated fairly. If the Congress or any administration can set Puerto Ricans against one another, that relieves them of all responsibility. So when it comes to the healthcare crisis and the very difficult economic crisis that you are confronting, the more unity you can have across all of the party and the historical lines that have divided you, the stronger you will be in making that case, and the less likely it can be that the Congress will be able to turn you away. And so for me, it is also probably worth thinking about doing a lot more, sending people around the country, particularly to places where a lot of Puerto Rican doctors, nurses, and just citizens have moved, to do a lot of television, a lot of radio, a lot of meetings, because you are not only working to build a coalition, starting with Puerto Ricans who live in the United States. You know, it always struck me as so indefensible that you can't vote for president if you live here, but if you move to Florida, which of course I'm just naming a state, you can vote for a president. And I think that a lot of Puerto Ricans are wondering, well, that makes no sense. Mm-hmm. You know, the geographic disparity and discrimination that exists within our laws makes absolutely no sense. I could not agree more. It makes absolutely no sense. But strength comes from unity. Good, effective arguments come when everybody is on the same page and nobody's being split off. So I've heard the Congress, you know, when I was in the Senate from New York and we would fight for some kind of tax exemption or something that would help Puerto Rico, we had to get everybody on the same page first, and then we went forward. And that's more important today than it's ever been. And then obviously trying to get the plebiscite set up so that maybe the decision can be made, and then we can turn the attention to making sure the Congress implements that decision. So I want to lend you all of my support, my best efforts on your behalf to try to figure out how we deal with the current crisis, which will only get worse. You know, it's like a medical condition. If you don't treat it, it will get worse. But you've got a healthcare crisis. If you don't treat it, it will get worse. And more people will suffer and more people will be left out. And as you were rightly saying, there will be people who are going to pay a price because they can't